This year, the National Alliance on Mental Illness, known as NAMI, is recognizing Mental Health Awareness Month with the More Than Enough campaign. One of NAMI's youth ambassadors, also an author, joins us to talk about mental health in kids and teens. Let's welcome Tanvi Arekapudi, a student in the Northshore School District. Thanks so much for being here.
Yeah, thank you so much for this wonderful opportunity.
Well, Tanvi, what made you decide to get involved with mental health awareness, let alone writing a book about it?
Yeah, so when I was moving from Ireland to the US about 4 years ago, I was going through a lot of emotions like stress, anxiety, isolation, and still overwhelmed with all those emotions. And all of those started to build up, and one day I couldn't handle it and burst out crying. And then at that point, my mom suggested a mindfulness exercise. After doing it, I realized it calmed me down and it really helped. And I remember doing this when I was younger, but not with intention. But at this point when I needed something that was there and I had it with intention, and it really helped me. And then when I knew something was there, I was looking and seeking the other coping strategies, like breathing techniques and the other ones that are out there. Knowing that helped me during online learning, COVID, like the isolation, I was seeing my peers and students and friends going through these emotions that I'm going through. And I'm like, I have something to help, so why didn't I share it? So I started a club, the Empowerment Club, where I had an open space, people could share their emotions, and I shared these strategies, and they implemented it in their lives, and they said it really helped them in their mental health journey. So I wanted to expand this to more students and more people around the world to help them know that they're not alone by sharing my personal mental health journey, so they know there are challenges we all go through, but also sharing coping strategies to let them know there is hope and there are things that can help.
Well, that's great that you saw the need in your own age group, because according to the World Health Organization, they're reporting that 1 in 7 of 10 to 19-year-olds is going through some sort of mental health disorder. From your perspective, what is being done right now to help your age group when they're struggling with some of these issues?
Yeah, so I think something that's being done right now is having education in schools. They're starting to have more education programs, and I know a lot of teens who are attending those classes that they share mental illness signs and symptoms, mental health challenges, and coping strategies based off that to help them learn more about them. But the most important thing is clearing those misconceptions that mental health is rare or it's not in children. By looking at statistics, they're learning that, and I think it's really important. Also, we're fostering more of those open talks in schools, and during lunch and everything, we talk about our mental health. And if one person talks about it empathetically, other people listen, and it can really have a chain effect to be able to talk more openly about mental health.
Right, because if more people are talking about it, others might feel more comfortable to do it too.
Exactly.
All right. Thank you so much for being here, Tanvi. Take a look at your screen right now. The NAMI helpline can be reached Monday through Friday, 10 a.m. to 10 p.m. Eastern Time. That number's on your screen. It's 1-800-950-6264. Tanvi, again, thanks so much for being here.
Thank you so much for having me.